identified that every wave happens because of the new variant. We had the first wave on February 2021 because of Alpha variant, and then May to June because of the Delta variant. I think that was the worst wave that we have ever had. And then the last one beginning of February because of the Omicron variant. And so far we identify the next variant is the BA4 and BA5 that we have identified 8 persons in Bali and Jakarta. Bali is imported cases because we have an international event, but Jakarta we have the local transmissions. So we have identified the potential BA4 and BA5. However, we still feel quite comfortable because BA4 and BA5 happens in South Africa first. If we see the cases in South Africa, the peak is only 1/3 of the Omicron and Delta. Hospitalizations is also 1/3, but fatality is only 10% of the peak of Delta and also Omicron in South Africa. We have identified some surges in European countries, US, including Singapore, but I strongly believe based on the evidence that it will be milder than the Delta and also Omicron wave. The second reason why we are also still quite comfortable is part lucky, I believe, is because of we did a zero survey. It's the survey of Indonesians' population antibodies. On December, we did the first zero survey, 34 provinces, 500 cities, 20,000 people. I think this is one of the largest after India for antibody survey. And we identify 86% of Indonesian people have antibodies, and the average level of antibodies is 400 units. On March, we did another survey after the Omicron peak, and it increased the number of Indonesians from 88% to 99.2%. Combining because of the vaccination plus the infection. So we accelerate the vaccinations January, February, and also there is an Omicron wave, so there is infections also that develop antibodies, so it's increased to 99.2% of Indonesian population have antibodies. And because of combinations antibody from vaccination and they got hit by Omicron, then the level, the unit is also increased to around 4,000 from 300 or 400 before. And I strongly believe it will maintain up till the next 6 months. So my rough calculation, and every country have a different. Singapore, you did the vaccination faster than us, so then your waning period is also will come faster. So when I saw that in March it's still high, March plus 6, our risk will be on September or October. And based on our research, this BA4, BA5, they are very quick also. They reach peak between 30 days and they start coming down. So Indonesia, we identified 2 weeks ago. So hopefully by July, the peak of the BA4, BA5 will be reached. And then because our antibodies level is still high, we believe that the severity of the hospitalization rate is lower, and then when it's going down, we still have the antibodies level until September. So that's why I'm feel quite comfortable because of the schedule of our vaccination is a little bit late. So when it comes, we still have a higher antibodies. But of course, what we are saying to our people is first accelerate the boosters, because the booster will increase your antibodies again, and keep wearing mask. In Indonesia, we are less aggressive in many countries in taking out masks because it's reduced the transmission. We will do another zero survey in June and July. So hopefully the BA4 and BA5 wave is going down already. So unless there is another variant then the risk is high. But if there is no new variant coming, then hopefully, if we can pass this August, September, that means that it's already 9 months we have a very low level of transmissions. Then hopefully that will be a good sign for the transition from pandemic to endemic. We don't know what God plan is, but if the new variant is not coming after BA4, BA5, and my feeling the BA4, BA5 peak will happen on July, where our antibodies level is still quite high because we reached the peak of our antibodies in the population on March. So we are quite well protected on September, and hopefully by September the transmission of BA4, BA5 is already going down. Then that is a good chance that our populations will be ready for this transition. The president asked me to do three things. First one, to execute the vaccination as quickly as possible. Now we have 416 million jabs to more than 200 million Indonesian people. So the first task is done quite well. The second task is to overcome the pandemic. Now we have less than 1,000 cases per day and keep for 3 months already, so it's done pretty good. Now the last one is the most difficult one. Budi, you need to do a major Indonesian healthcare reform. And he said, you're a banker, we have seen 2 global economic crises. It started in banking, the right policy response and the wrong policy response that we did, and every crisis opened up an opportunity to do reform. So why don't you do a healthcare reform, because this crisis started in health sector. And you understand how we did that before in financial crisis. So we identify 6 reforms that we like to do. The first one is close to my heart, and I think it's close to Singapore also, is to do major reform in primary care. I think as the Minister of Health, we need to focus on how to establish a healthy people, not curing the sick people. Otherwise, we need to change our ministry, the Ministry of Sickness, rather than the Ministry of Health. And then the second reform is reform in the hospitals. The third reform is reform in healthcare resiliency. So availability of vaccine, diagnostic therapeutics, and also healthcare workers. The fourth reform in financing, healthcare financing. The fifth reform in healthcare human resources. And the sixth reform in healthcare technology, both information technology and also biotechnology. So this reform we started and submitted to the Ministry of Planning and has been agreed on March, and now we are executing it this year. But again, I will concentrate on the primary care reform. We have 270 million Indonesians, 17,000 islands. To avoid them and make them healthy, not make them sick, is much more important rather than cure the sick people. And I have 10,000 puskesmas and 300,000 posyandu that I need to revitalize. Before, the posyandu only focus on babies and mother. Now we would like to increase it, give us standard healthcare services, not only babies and mother, but also children, adult, and also old people. And we put a standard, healthcare services that can be done, including laboratory services. Before, if you want to do diagnosis, we need the doctors to do clinical diagnosis. But with the improvement of technology, we can do also laboratory diagnosis. But laboratory is very expensive to build, especially for 17,000 island like us. But with the technology improvement, instead of doing the tests in the lab, you can do tests in a small device called a rapid test. I think the most successful example is pregnancy. Before, you have to go to the lab to test pregnancy, maybe 50 years ago. Now you can do pregnancy test quickly. COVID is also the same. Diabetes will be there, all the major diseases. We would like to push it instead of the lab. You do it using technology in the rapid test environment. So we can do rapid tests in 300,000 of posyandu without developing the labs. And that will identify early the cancer, the stroke, the potential stroke, a potential heart disease. So we can treat them early. They don't have to go to the hospital. Indonesia have 5 concrete agenda that we would like to achieve as a G20 president. 2 of them related with this fund. And this fund is actually started with the Italian presidency. But at that time, we cannot get into agreement. And it is also being initiated by one Singaporean senior minister, Tarman, because Tarman sit at the high level independent panel with Ngozi and Larry Summers. So Ong Ye Kang, when my first trip as a health minister, July last year in Italy, I just get to know your health minister, and he mentioned that, Budi, I think we cannot close this, so it will be your responsibility. So we are continuing the Italian initiative for this fund, and to be honest, it's successfully being established. Now with Indonesian contribution 50 million US dollar, we reach 1 billion size, and we can leverage this further. And this morning I met with your health ministers, and Ibu Sri Mulyani met with your finance ministers, and thanks to Singapore, you also give a commitment of 10 million US dollars. So thanks to Singapore. I would expect Singapore can add more. You are the richer country. But anyway, it is a good sign. And then now, hopefully we can increase this fund by going out to other rich countries from G20. And then after that, the discussion will be, hopefully we can solve it in June in Health Ministers meeting in Jogja, is the uses of fund. So what are the governance to use the fund, how to channel it within countries, how to prioritize in different segments, and what kind of emergency health countermeasure, whether vaccine, therapeutic, and diagnostic, that we need to access.